All right. Hello, my name is Jason Orcena, Health Commissioner for Union County. Just wanting to provide a little bit of an update on what's going on in Union County and what we're looking forward to with the reopening of several of our businesses. Obviously, we've begun that process already. There are some additional businesses that will be coming online over the next few weeks, which I know many of you are excited about. One of the things we want to encourage you to do, both if you're an employee of a business or a business owner or just a customer, is sort of recognize that there are some changes, some safety precautions that are going to be with us for some time, even as we partake of these new businesses in our summer activities. So things like the use of masks, we're going to see those in the workplace for probably some time to come. A lot more telehealth, again, keeping that social distancing in mind, the 6 feet, trying to limit those interpersonal interactions in business environments as much as possible. All of those things will remain with us for quite some time to come. Encouraging folks to remain home when you're sick. I know that can be very difficult to think through, but planning for that, planning for potential COVID related illness, all those things are going to be with us for a while because the risk still remains. Now, even though the risk remains, we are now in the stage where we have to start weighing up our individual risk as we engage in activities. There are some things you've probably put off doing for a while. Now's the time to start thinking about those. If you have small children, your well child visits. It may be time to start looking to the future and reaching out to your provider about some of those doctor visits that you've put off at this point to see if it's warranted, and have that communication and that conversation with your healthcare provider about when is the appropriate time to do those. As we think about what the risk is moving into the future, we can mitigate that risk to some degree. We can do that by, again, social distancing, making sure we're enhancing the amount of hygiene we're engaged in on a regular basis. So hand washing on a regular basis all through the day, as well as cleaning our surfaces, high contact surfaces, all those things that will remain with us. And what that will help do is mitigate any risk you have. It doesn't eliminate the risk, it's meant to mitigate the risk. And we still want to take care of those vulnerable populations. So our older folks or folks who have underlying medical illness, we want to continue to support those individuals as we work our way through the next several months. The last thing just to share with you is what is our response, what is the EOC and the health department working on right now. It is how do we move forward with this environment being what it is for the time to come. One of the things that we will be looking at as a health department is how do we respond really quickly if we get cases of COVID-19 in an environment. So responding for businesses, responding in different centers, and being able to move quickly to isolate those cases to prevent the spread of the disease moving out into affecting more people or moving into a vulnerable population. We won't be able to stop the spread of the disease. It will continue to spread, but our goal is to slow it down as much as possible. So again, we encourage you to continue to do what you've been doing all along. We've had a great working relationship with all of our businesses as they try to reopen, good interactions with all of our folks that we've been involved with. We appreciate you all so very much for what you've done to keep our community safe. If you have questions, don't hesitate to reach out to us. We look forward to talking with you and working with you as we move through this new experience together.